Darryl McElveen, Pleasantburg Veterinary Clinic, and we want to talk to you for a few moments here about pet dental health. Throughout the country, the month of February is designated as National Pet Dental Health Month, and this is just done to bring awareness to the public about the necessity of taking care of your pet's dental health. We are often amazed when we're doing our annual checkups on our animals and we're evaluating the dog or the cat, and part of it is to evaluate the mouth, and we look into the mouth and we see dental disease. It can be as mild as just excessive tartar accumulation, but it sometimes is as severe as erosion of the gum line, loosened teeth, ulcers in the mouth, and infection of the tissues of the mouth, the gums there. And owners are very often surprised when we show this to them. They say, oh my gosh, I had no idea. So one of the things we're going to do today is I want to show pet owner how to very easily, very simply just look at the pet's mouth, the dog or your cat, it doesn't matter which one, and evaluate what it looks like. Oftentimes people will say, yeah, the breath smells terribly, but they just don't think to take the next step, which is to open that mouth and take a look. A lot of times, if you catch these dental problems early, while it's just mild tartar or even moderate tartar buildup, and we clean the teeth, polish the teeth, then we have delayed the complications of dental disease. And like I said, sometimes it's nothing more than just tartar buildup. The importance of knowing about this is that with this tartar buildup, and as it continues and it works its way under the gum line and we start to get infections in the gum line, infections of the roots of the teeth, infections of the sockets of the teeth there, then this bacteria that's causing this problem has been demonstrated to cause multiple problems throughout the body. The least of which is, not the least of which, is that these bacteria have been shown to set up infections on the valves of the heart. And when we get infections on the valves of the heart, then this starts to damage the heart valves and can lead to scarring of these valves. If we get scarring of the valves, then these can lead to murmurs. Therefore, the heart not acting as a correct pump because there's a leak in the valve. And then secondary to a pump, heart not working well as a pump, we could start to get the problems from a inefficient, ineffective heart. The other complication that has been demonstrated is that these bacteria will become systemic, get into the blood, they absorb through the gums, just direct shot into the blood from the gum line, and they set up infections in the kidneys. And once they set up an infection in the kidneys and damage the kidney tissue, well, that kidney tissue is gone. Kidneys do not regenerate, so once we get some severe infections in those kidneys, damage of kidney tissue, then we get the subsequent complications of kidney disease. So these being the two of the major problems that occur, but then again, not least is the hygiene in your pet's mouth, having them sitting there panting in your face and it's smelling horrible and you don't know why it smells horrible. So we're going to pause here in just a second. I'm going to get a pet here on the table and demonstrate to you how to do this. Now granted, I'm doing a pet who is very compliant, it's going to allow me to do this, but most pets will allow their owner to do this at home. It doesn't have to be a major, it doesn't take but 15 seconds to do this. And yes, cats are more difficult, and yes, cats get dental disease as well, but it is something that is, I think, necessary for the pet owner to do, so they're not surprised when they come in here once a year and we say, well, we've got some nasty dental disease. So we're going to pause right now and get a pet here on the table and show you what to do. Okay, this is Ella, 5 years old, and yes, she is very easy to work with, so this is perhaps not fair to y'all watching this, but what we like the client to do is maybe once a quarter, just lift the upper lip, sort of pull back, and you're evaluating the gum line, evaluating the tartar. She has very mild tartar buildup on this upper canine, almost no buildup on the bottom teeth down here. Just come to the front, separate the lips and look at those. This one classifies as very good dental health here, other than some tartar buildup on these canine teeth. We can see back in here, the gum line is very healthy, the teeth are very clean back in here. And then if you can, just open the mouth and look on the insides. Now Ella's look good. She's good dental health, there's no problems going on with her. So if you do this, if her owner would do this once a quarter, she would be aware of what's going on and would be aware of any changes that have in the past 3 to 4 months have occurred, and we can address those problems much more easily, much more simply when they're just beginning, as opposed to when we have advanced disease and the teeth are rotting and the roots are rotting and the gums are eroding and we have to extract the teeth. Clients ask us, well, what can we do at home? Well, obviously the gold standard is brushing your dog's teeth. That becomes kind of difficult, becomes excessively difficult on a kitty cat. That is the gold standard. I don't know of anyone who does it. I don't do it personally to mine. I just check them regularly. If there's a problem, I address it. But there's things such as brushing the teeth. There are additives that you can put in the water that contain chemicals that will break down the normal plaque that develops in our mouth before it becomes too sticky and starts to get mineral content in it and becomes hard tartar like we see on some of these animals. People who will tell us when we show them the mouth of the dog or the cat, they say, well, I feed them hard food, why is this occurring? Well, theoretically, if you are abrading the teeth by chewing on the food, the hard kibble, that is certainly breaking up some of the plaque, some of the tartar. However, most dogs do not sit there and chew and chew and chew on their hard kibble. They usually just crack it, swallow it, crack it and swallow it. So in concept, feeding hard food is a good idea. It doesn't mean feeding canned food is a bad idea, but if you rely on feeding the hard food as your total dental approach, you're going to be disappointed. It's not going to work. You're going to have to get more aggressive. Like I said, either chew toys that may cause them or may allow them to work the gums and massage the gums and massage the teeth. There are actually chews, rawhide type chews, which the animal has to really work on, and in working on these things and getting abrasion up and down on the teeth. There are rawhide chews and supplements or chew products that contain certain chemicals that will once again break down the sticky plaque before it becomes infiltrated with the minerals from the mouth, which then forms the hard tartar, which then starts working under the gums. So there's multiple approaches. There's things the owner can do at home. If you're diligent with them and stay on them, they're going to help. It's a rare animal that we don't see. It's a rare animal that we see at, say, age 9, 10, or 11 that does not have enough tartar and dental disease that they require dental cleaning. And the reason we bring that up, and this being the month, February, the month of National Dental Health Month, is most clinics throughout the United States, in an attempt to get owners aware of it and get them to do something, offer discounts for dental services the month of February. And we do the same thing. So we just want to encourage you to pay attention. It's very simple to do. If you even have a question, you just run them up here and we'll take a look for you and show you. But don't neglect looking in your pet's mouth. Don't think just feeding hard food is enough. And if you're smelling an odor in that pet's mouth and you keep pushing him away because his breath is knocking you out, then let that be your little red flag to open that mouth like we showed you and take a look. Best of luck. Thank you very much.